Okay, so I'm just outside of my patient's room right now. I'm outside of Jane Smith. I'm just going to be checking her chart. I'm going to be going in to be giving an intramuscular injection. So the doctor ordered that she take ketorolac, and so I have my ketorolac right here. I'm making sure that that is for Jane Smith and that's what it says on the order. So we're good there. Checking their chart of anything. So now I'm just going to take all of my supplies that I have and I'm going to enter the patient's room. Okay, I'm just knocking on the patient's room. I'm going to enter and I'm going to introduce myself. Hi, Mrs. Smith. My name is Drew. I'm going to be your nurse today. We're going to be giving an intramuscular injection for your pain that you've been having. We know you came in with pneumonia, and so, but then you've had lingering effects and some pain, so we want to help with that. So first, I am just going to ask for a patient identifier. So I'm going to ask for your name and your date of birth. So we see on your bracelet, and then we're going to match it with the chart, and that matches up. And I'm just going to ask if you have any allergies. No known allergies. That also matches with the chart. So now I'm going to wash my hands, and then I'm going to put some gloves on. Maybe. Okay. This is good. Okay. So before we do any of this, I'm going to just close the curtain to make sure that we have privacy for this patient. So now I am just going to, scan the wristband. And now I'm going to be scanning this medication for Jane Smith. I'm going to scan the ketorolac that was ordered. Okay, perfect. So it comes up. Okay, so I would just go into this and I see that this is for Jane Smith. They're ordering ketorolac. They are giving it through the arm, intramuscular. They are getting it now. The right dosage is 15 milligrams, and we want to make sure that we document that right. So we just want to now get ready to draw everything up. So checking ketorolac. So I'm going to clean this. I'd also want to check for the expiration on the medication to see that that works. This is 30 milligrams per milliliter, so we just want to make sure that we're going to be giving the right dosage to Jane Smith. So I'm just going to clean that off. And then I'm going to pull out a needle, make sure that I have exactly what I need. Yeah, I'm just going to make sure that I'm getting the right thing. So, okay. I think I have the right, if I'm reading this right. Okay. I think this would be right. So 1 inch, 23, 1 inch. So we're going to take this, and then we need 0.5. So I'm going to take this 3 milliliter, and I'm going to open this syringe up. I cleaned that. So before giving this as well, when coming in to, I'm just going to set this up really quick, and then I don't want that to turn off. Okay, I I'm just going to do one last check just to make sure before I draw this up that this is Ketorolac for Mrs. Smith, for Jane Smith. Before I draw that up, I just want to first ask Jane Smith how their pain is doing. So I noticed that on their chart they said that they were at a 5 out of 10. So Jane, could you tell me what your pain is on a scale from 0 to 10? It's still a 5, so this is why we're giving this medication. So I'm just going to teach my patient that this medication is for pain. So it's an anti-inflammatory medication. That's why we're giving it. We're going to be giving it into your arm. Intramuscular through an injection. There could be some side effects that you might see, and you might have an upset stomach, you might have nausea, dizziness, these things like that, and we want you to let us know when you have these, if you have any of these, and we just want to tell you that that you could take it with food. We don't want you to have alcohol while you're on this medication. If you're pregnant, we wouldn't do this, and we would find another route for that. All of these things. Also, when you give this shot, you might have some pain, and that could be normal. But we just want to alert you and notify you of these things, and we want you to tell us as well, and hope that we can help your pain go down, okay? So we assess the pain. Our patient's sitting in the wheelchair. They're in a position where they're sitting up, so we can give it to them like that. So now I'm going to draw my medicine up. And again, we checked, we made sure that this is for the right person. I'm just going to take this off, and I'm going to draw up. Just going to be using the scoop method. So I'm just going to pull my lid over here, and I'm just going to scoop this up with one hand. Then I'm going to put this back on and prepare this for the patient. Now I'm going to switch my gloves out here, and I'm going to change my gloves to give this medication. Sorry, my computer turned off. We'd also, on their chart, we'd want to check for the right amount for their age. And so we checked, and this is the right amount for them. Okay, now we're just going to get our alcohol wipe ready. Okay, we're just going to pull up their sleeve. So you check from the bone right here, 2 fingers down, and then we are here on the deltoid at this triangle. So that's where we're going to be giving it. So I'm going to wipe this spot right here. So we have our 2 fingers right here. Okay, I'm going to be doing the Z-track method. So I'm going to be pulling the skin over. I'm going to take this cap off. I'm going to be pulling the skin over. And I want to be giving this at a 90 degree. So, and we're going to dart this in. So I'm pulling the skin over, and I'm going to push this in. And then I'm going to hold, while I'm holding the skin, I'm going to hold this, and I'm going to press this in slowly. And then I'm going to pull this out, let the skin go, and then I'm going to put my cap on. I'm going to throw this into the sharps, and I'm going to put a Band-Aid on them. Okay, now take my gloves off, throw that away. Okay, so I would just want to make sure that I documented everything that was needed on here. After giving the medication, I would chart what we taught them. So we taught them about the side effects and that it may be a little bit sore, and that we will be coming back in the next little while to check on you to make sure that this medication is working, that we're getting their pain down. I'm just going to get him back in a comfortable position, get Jane back in a comfortable position. And if Jane had any questions, we would answer all these questions. But at the moment, do you have any questions, Mrs. Smith? Okay, no questions. So make sure we charted everything, that we put everything away in the sharps. We're going to just clean everything up and we should be good.